what our members are wanting and what patients are want is good information, reliable sources, and to know what's currently available and maybe what's coming, and understanding their disease state. So the better educated patient is the patient that actually will take care of themselves.
Hi, I'm Piya Sircar. I'm the U.S. head for Rhinology, Allergy, and Gastroenterology, and it's my pleasure to be here with Todd Mahr, who is the Executive Medical Director for the American College of Allergy, Asthma, and Immunology. So thanks for being with us here, Todd. Pleasure to have you.
Thank you. I know it's a mouthful. We refer to it as the college quite a bit, so that helps.
Speaking of that, why don't you tell me a little bit about the mission for the college and share a little bit about that?
Sure. The college represents really community allergists. We have academic allergists and community allergists, but we're really an organization representing allergy immunology in the community. The mission is, what can we provide for our members to help them take care of their patients? And so that's what my role as Executive Medical Director is to make sure we smooth out the edges from every president that we have annually to make sure we're consistent in what we're doing. We have a lot of initiatives that we do for patient care. We have a website that is huge and gets lots of hits by patients, and they use that for a lot of information. We provide handouts for our allergists to give out, and we support research. And that we basically have research on our website so patients can be aware of what research is out there that they want to participate in.
Wonderful. So speaking of patients, could you share a little bit more about, what are you hearing from patients? What is driving their questions, and what are you hearing that kind of compels some of the actions that the college is taking to work with?
Allergists really cover a gamut of areas. We take care of patients with atopic dermatitis and allergies and immune deficiencies and urticaria, hives, and a variety of other aspects. And so we've got patients that sometimes march through those diseases. They come to us very young with atopic dermatitis, and then they start developing asthma and other allergies. Or we get some that just come out of the blue and they have eosinophilic esophagitis. So what our members are wanting and what patients are want is good information, reliable sources, and to know what's currently available and maybe what's coming, and understanding their disease state. So the better educated patient is the patient that actually will take care of themselves. And with us having a team approach of, we're a partner with the primary care provider to take care of that patient.
Yeah, no, that's wonderful. Now, I'm biased as an immunologist as well, but I think that is truly the importance of allergy, right? Seeing patients from younger patients to older patients, diseases that really affect multiple organs potentially, and allergists are really uniquely positioned to have that broader understanding of what might be the immunological process that's driving the disease.
And you hit it on the head, and I do primarily pediatric allergy, and I've been a lot of kids' primary doctor almost. I don't want to be necessarily, but because they have all these immunologic issues, I'm the one who kind of helps coordinate care. And so it's a good role to be in, and we like partnering with pharmaceutical companies because they actually are developing the treatments we're going to use.
No, that's wonderful. Now, and as you think about it, speaking of patients, and we've had a strong partnership and collaboration together, what is the most urgent thing that you think we can do for patients, either as the college directly or in partnership with a company, as an example?
Well, I think a good example is recently we worked to produce a type 2 inflammation website and education module. And so it really is made for patients and primary care providers, because those are really two areas that need to be educated. We're trying to educate the patients so they know more, but we want to get it out to the primary care providers because they're going to refer to us. And that's important. If they're not referring to us, we're not going to see the patient. And a lot of times there's patients who just stop at their primary care provider and don't know more. Whereas if they can get information from this website, part of that was also a slide deck for our members to use when they're going out in their local communities to do grand rounds and talk to primary care providers. And we've had a great number of downloads of that already, which is wonderful. So our members don't have to create the talk. They have a unbiased, nice talk that's created that covers type 2 inflammation and helps get the word out, which is fantastic.
No, that's wonderful. And as you said, it's sort of educating the ecosystem, right? From primary care to specialists, because you also, as allergists, are often working with other specialists, right, in the treatment of a particular patient.
Yeah, and we need them as partners.
Yeah.
And so we've learned that over the decades that they're kind of a gateway to us.
Yeah.
And we don't steal patients from them, but we work with them and keep the patient as healthy as we can.
Thank you so much, Dr. Mahr, for being with us today and sharing. I really appreciate the partnership that we have with the college and what we're truly doing to improve patient care and continuing to partner with the allergy community.
My pleasure. Thank you.